Contraception. We're going to talk about the barrier methods first. I will explain the method, what it is, the failure rate, and its risks. The male condom. It can be latex or polyurethane. It's a thin sheath placed over the erect penis to stop sperm from reaching the egg. It must be worn every time you have sex. Its failure rate is 11 to 16%. The risks are irritation, allergic reactions. Except for abstinence, latex condoms are the best protection against HIV/AIDS and other STIs. The other barrier method is the female condom. It's a lubricated, thin polyurethane pouch put into the vagina. You must use it every time you have sex. The failure rate is 20%. And the risks are irritation, allergic reactions, and it may give some protection against STIs. Another barrier method is the diaphragm with spermicide. It's a dome-shaped flexible disc with a flexible rim made from latex rubber or silicone, which covers the cervix so that sperm cannot reach the egg. You must use this every time you have sex. The failure rate, 15%. The risks are irritation, allergic reactions, and urinary tract infections. If it's left in longer than 24 hours, there is a risk of toxic shock syndrome. This does not protect from STIs. Another barrier method, it's sponge with spermicide. It's a disc-shaped polyurethane device with spermicide, non-oxynol 9. It must be worn every time you have sex. The failure rate is between 16 and 32%. The risk, irritation and allergic reactions. You may have a hard time taking the sponge out. The risk of toxic shock syndrome if left in over 24 hours. And this does not protect from STIs. Another barrier method is the cervical cap with spermicide. It's a soft latex or silicone cup with a round rim which fits snugly around the cervix so the sperm cannot reach the egg. It must be worn every time you have sex. The failure rates, 17 to 23%. The risks, irritation, allergic reactions, and abnormal Pap tests. If in place longer than 48 hours, there's a risk of toxic shock syndrome. This does not protect from STIs. Spermicide by itself, a form of cream, jelly, film, or tablet that kills sperm. You must use it every time you have sex. The failure rate is 30%. The risks, irritation, allergic reactions, urinary tract infections, and this does not protect from STIs. Hormonal methods. Oral contraceptives. These are the combined pill. This is a pill that uses hormones, estrogen and progestin, to stop the ovaries from releasing eggs in most women. It also thickens the cervical mucus, which keeps the sperm from joining with the egg. You must swallow a pill every day. Failure rates, 5%. Risks, dizziness, nausea, changes in your cycle or your period, changes in mood, weight gain, high blood pressure, blood clots, heart attack, stroke. This does not protect from STIs. Another hormonal method is oral contraceptives, progestin only. This is a pill that has only the hormone progestin, which thickens the cervical mucus. This keeps sperm from joining with an egg. You must take a pill every day. Failure rate, 5%. The risks: weight gain, irregular bleeding, breast tenderness. It's less protection against ectopic pregnancy. This does not protect from STIs. Another hormonal method is oral contraceptives, extended and continuous use. It's a pill that uses hormones, estrogen and progestin, to stop the ovaries from releasing eggs in most women. This thickens the cervical mucus, which keeps the sperm from joining with the egg. You must swallow a pill every day. The failure rate, 5%. The risks. The risks are similar to other oral contraceptives. You have fewer planned periods. You're more likely to have bleeding and spotting between periods than other oral contraceptives. And this does not protect you from STIs. Another hormonal method is the patch. A skin patch that is worn on the lower abdomen, buttocks, or upper body, which uses hormones, estrogen and progestin, to stop the ovaries from releasing eggs in most women. It thickens the cervical mucus, which keeps the sperm from joining the egg. The patch must be changed once a week for 3 weeks. During the 4th week, no patch is worn. The failure rate, 5%. The risks: exposure to higher than average levels of estrogen than most oral contraceptives. There's possible risks of blood clots. They're greater with a skin patch because of the greater exposure to estrogen. Another hormonal method, vaginal contraceptive ring. It's a flexible ring about 2 inches around that is placed into the vagina and releases hormones, progestin and estrogen, to stop the ovaries from releasing an egg. It also thickens the cervical mucus, which keeps the sperm from joining with the egg. The ring must be left in every day for 3 weeks. During the 4th week, no ring is used. The failure rate is 5%. The risks: vaginal discharge, swelling of the vagina, and irritation. Other risks are similar to oral contraceptives. This does not protect from STIs. The shot or an injection. A shot of the hormone progestin that stops the ovaries from releasing eggs. This also thickens the cervical mucus. The shot must be given every 3 months. Failure rate, 1%. The risks: you may have bone loss after 2 years. You'll have bleeding between your periods. You have weight gain, breast tenderness, headaches, and this does not protect from STIs. Implanted devices, the IUD. A T-shaped device that is put into the uterus by a healthcare provider. A one-time procedure. The failure rate, 1%. Risks: cramps, bleeding, pelvic inflammatory disease, infertility, tear or a hole in the uterus, lower interest in sexual activity, change in your periods, and this does not protect from STIs. Implantable rod. A thin matchstick-sized rod that contains progestin. It stops the ovaries from releasing eggs or stops the sperm from joining the egg. It's placed under the skin of the upper arm. It's a one-time procedure. Failure rate, 1%. Risks: acne, weight gain, cysts of the ovaries, mood changes, depression, hair loss, headaches, upset stomach, dizziness, change in your period, and this does not protect from STIs. Permanent methods for women. Sterilization surgery for women. It's called a transabdominal surgical sterilization or surgical implant. It's a device placed on the outside of each fallopian tube. The tubes are blocked so the egg and the sperm can't meet in the fallopian tube. It's a one-time procedure. Failure rates, 1%. The risks: pain, bleeding, infection or other complications after surgery, ectopic or tubal pregnancy, and this does not protect from STIs. Sterilization implant for women. Transcervical surgical sterilization implant. It's a small, flexible metal coil that is put into the fallopian tubes through the vagina. It causes scar tissue to form around the coil. This blocks the fallopian tubes. It's a one-time procedure. The failure rate is 1%. The risks: mild to moderate pain after insertion. Ectopic tubal pregnancies. Does not protect from STIs. Permanent methods for men. Sterilization surgery for men. Vasectomy. A surgery that blocks a man's vas deferens, the tubes that carry sperm from the testes to other glands. Semen never has any sperm in it. A one-time procedure. Failure rates, 1%. Risks: pain, bleeding, infection, and this does not protect from STIs. Emergency contraceptive. If your primary method of birth control fails. Emergency contraceptives, or the morning after pill. These are pills with hormones, either progestin plus estrogen, that is similar to oral contraceptives. It stops the ovaries from releasing eggs, or it stops the sperm from joining the egg. You must use it within 72 hours of unprotected sex. This should not be used as a regular form of birth control. The failure rates, 15%, and the risks: nausea, vomiting, abdominal pain, fatigue, headaches, and this does not protect from STIs.